I want to start by saying thank you for joining us on what will be an incredible educational opportunity for everybody here. My name is Sasha Kelchef-Korn from Realm of Caring, and it's my pleasure to introduce you all to Dr. Bonni Goldstein. So following today's presentation, we will have time for a Q&A, so just make sure that you're using that question box or typing it in chat, and I'll make sure to moderate that towards the end, and we'll get your questions answered. And whatever we don't have time for, don't worry, we got you. We'll email you resources to help you continue your educational journey. So Dr. Bonni Goldstein, who's here with us today, she's treated thousands of patients with cannabis medicine. She's lectured all over the world. She's authored the book, Cannabis is Medicine, and she continues to educate physicians through Goldstein Wellness at goldsteinwellness.com. And she strives to connect patients to quality vetted products from reputable brands. And so thank you for joining us today, Bonni. What an honor. And I will let you take it from here.
All right. Well, thank you so much. And I do just want to give a shout out to Realm of Caring. They are truly they are the caring in Realm of Caring. So my experience with Realm of Caring started back in 2013, I believe, when they first started. And I have tremendous respect for what you guys do and how you continue to support patients on their cannabis journey. So I just want to say thank you. And I also want to say thank you for being flexible and being able to transfer this talk from previously scheduled. My father was not feeling well that day and I needed to help out. So here we are, though, and he's having a good day today. So we'll be thankful for that. My background, if you're not familiar with me, is I've been a licensed physician in California for more years than I want to admit. I trained at Children's Hospital Los Angeles as a pediatric physician, but I was always really kind of an adrenaline junkie. And I went into critical care transport for Children's LA. And then I went into pediatric emergency medicine for a little over a decade. And in 2007-ish, I had a friend who asked me about cannabis for cancer. And here in California, we've had medical cannabis since 1996. And I'm one of, I'm sure, most clinicians who really didn't know anything about cannabis, despite the fact that we had a law that allowed us to recommend it to our patients. When my friend asked me about it, I did a deep dive into the scientific literature, and I could not believe that I didn't know about the endocannabinoid system or about cannabis as medicine. And so I became intrigued as a science geek, but also to help my friend. And what I witnessed with her was transformative. Took her from, frankly, laying on the floor in the bathroom after chemotherapy, not sure which end should face the toilet, not to be graphic, but to sitting at the dinner table with her children, having dinner. So I saw that there was some remarkable positive therapeutic benefits. And so I started working in the field in 2008, and I'm a medical director and owner of Canna Centers, which is my medical practice. I also started a company last year called Goldstein Wellness, which is focused on educating licensed healthcare practitioners about cannabis. They are like the last bastion of people to kind of come over to from the dark side to be positive about cannabis. And so I think the science needs to get out to them, and that's why I started that company. That company also connects patients with knowledgeable clinicians and also helps advocate for vetted quality products. I'm a board member of the International Alliance for Cannabinoid Medicine, which is based out of Germany, but we have groups everywhere. I'm also a member of Society Cannabis Clinicians, and I'm a clinical advisor to a couple of different companies doing some consulting work. But today we're going to get through learning about the endocannabinoid system. We're going to talk about what is endocannabinoid deficiency. We're going to talk about the endocannabinoid system as it relates to inflammation, especially because when you think about inflammation, you think about the root cause of many conditions. Inflammation is what tips us over into chronic illness. And we're going to talk a lot about that. We'll talk about cannabinoids and inflammation, some important points, and then also I'll just share some patient reports with you. So why do we even look at cannabis as medicine? how did that even become a thing? And the whole idea is that the compounds that are in this plant are not foreign to us because we make our own inner cannabis-like compounds. And those are called endo, for within, endocannabinoids. So this system, this endocannabinoid system, was only discovered in the late 1980s, specifically in 1988, when scientists figured out that we had these receptors. They knew about these receptors. They called them orphan receptors because they didn't know what they did. So they were called orphan receptors. Every receptor we have in our body has a compound that links to it, like a key in a lock. So think about a receptor like a lock, or sometimes people call it like a docking station, and something comes along, a compound, and binds to it. You can also have compounds that block it. You can have compounds that partially bind. You can have compounds that bind on the side. CBD binds on the side of our cannabinoid receptors. But back in the 1980s, they had known about these receptors, but they did not know what they were for. And a researcher in St. Louis took fake THC, synthetic THC, and put a radioactive label on it and followed where it went in an animal brain. And lo and behold, that THC compound was binding to these orphan receptors. So they renamed the orphan receptor the cannabinoid receptor because THC is a cannabinoid from the plant, which we refer to often as phyto, P-H-Y-T-O, phytocannabinoid. So that was a very important discovery in 1988. And what our scientists said was, if we have these receptors and they bind to THC that's coming along from outside the body, what from inside the body is binding to that receptor? And that led to the discovery of what we call our endocannabinoids. So what you see here in the graphic is the receptors here, and this is on a neuron. And this neuron right here is the end of the neuron. It's sending a message, as you can see the arrow going here, this sending a message of neurotransmitters, which are these little red dots, across from the end of this neuron to this other neuron that it's connected to. This gap between them is called the synapse or the synaptic cleft. And what happens is your neurotransmitters like serotonin, like norepinephrine, like dopamine are being released from signals that we get. A bear is chasing you, you're going to release neurotransmitter to go fight or flight, right? So release neurotransmitters across, they bind to a receptor here and send a message from this neuron to that neuron. When the message is often too much, what happens is this receiving neuron says, that's a little too much message. I need you to dial that down. And releases your natural endocannabinoid, your inner cannabis-like compound, and sends it back to this receptor, which it binds to on this sending neuron and says, dial it down. I call it like a volume knob. Okay, if my son's in his bedroom blasting on his guitar, and his door is locked and I can't get in there to tell him to turn it down, I put the key in the lock, open the door and say, hey, turn it down. That's basically what your endocannabinoid system is doing on the most simple level. Regulating, master balancing, right? A master balancing system to keep those messages that are being sent in balance. And we'll talk about a little bit more of like what, a little more detail. I'll give you some examples of how this works. Be aware that this receptor system, so in the medical world, we talk about a neurologic system. So it's your brain, your spinal cord, and your nerves. If you talk about your GI tract, your mouth, your esophagus, your intestines, and so on. When we talk about the endocannabinoid system, it's everywhere. And that's why it's so important. And that's why it is involved in so many different functions and physiologic processes in our body. So I'm focused here on brain, gut, and immune system because that's where a lot of the density is. And if you think about your brain, it's the master computer. When you think about the gut, it's the second master computer. We now know. When I was in medical school, nobody really talked about that. But there's no question we talk about the gut being a second brain, chock full of cannabinoid receptors. And also our immune system which regulates our inflammation. These are all heavily populated with the endocannabinoid system. Now, it's important to understand that this is a survival system. By comparing genetics of different species, the cannabinoid receptors in different species, scientists estimate that the endocannabinoid system evolved in primitive animals, like I've shown here, the sea squirt and so on, over 600 million years ago as a response to stress. So you get hit with a stressor, you may get knocked down. What's going to get you back up is getting all of your cell messages back into balance. So it's really important to understand that the endocannabinoid system is crucial to being healthy and surviving. Type 1 cannabinoid receptors, so there's two that have been identified, type 1 and type 2, and we label them CB1. CB1 receptors evolved before first vertebrates even appeared, but the CB1 receptors are found in all vertebrates. And the way that it's been described very nicely by some researchers, it is our brakes on our nervous system. So remember, sending too much message kind of triggers your body to make your endocannabinoid to give that message back, say, dial it down. So it's like putting the brakes on. We would not survive very long if we were in fight or flight all the time. So think about that, right? If we're on all the time, something's going to happen. Our systems break down. And that often is an issue with chronic illness, is that we feel like we're in fight or flight all the time. I'm sure people can relate to that. Our type 2 cannabinoid receptors actually resulted from a gene duplication event during evolution. But the way to think about the type 2 receptors, which are more involved with your immune system and inflammation, are brakes on your immune system and inflammation. Your endocannabinoids work to rein in. Yes, you want an inflammatory response if you're ill, but you don't want an over response. You want to rein that in. So conditions like autoimmune disorders like multiple sclerosis or lupus, those are autoimmune conditions where the immunity is kind of overactive, over turned on. And that's why a lot of people say cannabis helps. It helps rein it in when the body's endocannabinoids cannot be doing that work. So what are the components of the classic endocannabinoid system? So you have these two receptors that I've mentioned. You have your inner cannabis compounds called endocannabinoids. AEA stands for anandamide, and 2AG is another one. These two are the two that have been most researched and the ones that have been even checked in, like levels have been checked in spinal fluid or in blood. These are not levels that you can just go running, like you can check your glucose level or your white blood cells. You really can't go to the lab and get an anandamide level. These are more done in research studies. But for instance, anandamide, low levels of anandamide have been described in children with autism. So remember, if you're always kind of hyper or fight or flight or kind of overactive, your brain may not be sending out anandamide to help rein that in. And that kind of makes sense when we think about a child who has autism, who's very irritable or overactive or has outbursts. Their brain is not putting the brakes on. Okay, the brakes are not working very well. And then we have enzymes. Enzymes are part of the system because they are responsible for making these compounds and also for breaking them down. You do not have these compounds just sitting around waiting to work. They are made on demand. Anandamide, 2-AG, and your other endocannabinoids are made from healthy fat compounds, omega-3, omega-6 in the right balance. And what's somewhat kind of disheartening is back when I was in medical school, maybe just even in college, everything was like low fat this and low fat that. And everybody, if you're not, and in products, if you buy low fat, what do they substitute is sugar. And when you think about it, we have a whole population of people who reduce the amount of fat they ate because of what cardiologists were telling us. And yet I really believe that created a lot of problems for that generation, of which I am part of, in terms of having good homeostasis and a balanced endocannabinoid system. And certainly we've seen obesity and hypertension and metabolic syndrome all as a result of kind of getting away from healthy fat and getting into too much inflammatory sugars and so on. All of these components of the endocannabinoid system are controlled by your genetics, but also by what we call your epigenetics or epigenetic factors, like your diet, your stress, whether or not you exercise, do you sleep well at night, are you exposed to toxins, what are your life experiences, were you exposed to trauma early on in life? So if you think about it, the genetics gives you kind of the blueprint for your endocannabinoid system. But then your epigenetics, the best way to think about that is like, if you have a garden, how well are you taking care of your garden? Can you nurture your garden? Are you neglecting your garden? So it's a good way to think about the endocannabinoid system is, yes, I have this genetic programming, but my choices in life, my lifestyle options also influence my endocannabinoid system and how well it works to get me back into balance when I need that, when I've been exposed to a stressor, whether an illness, whether an infection, whether it's some type of traumatic insult or some other type of stressor that comes along. Now, when we look at where these receptors are, it makes perfect sense that when somebody says to me, how can cannabis, how can one plant be used to treat nausea, but also treat pain and also treat epilepsy and also treat cancer and also treat this, that, and the other thing? Again, these receptors and the endocannabinoid system are everywhere. And we normally talk about, or usually talk about, CB1 receptors kind of being in the brain and nervous system and type 2 elsewhere, but really there's a lot of overlap. When you have a brain insult, believe it or not, so if you were a football player and you got clonked in your head, that inflammation that is triggered by that insult to your brain creates a dial-up of your type 2 cannabinoid receptors, which then your endocannabinoids can be produced, bind to those receptors, and lower that inflammatory signaling. So our bodies are not just sitting with a certain amount of receptors, they're dynamic and they can change. And again, genetically controlled, but also controlled by lifestyle choices and injury. We know too, in fact, we'll talk about this, when you have neuropathic pain, there's a maladaptive response where your number of receptors go down. And that by using outside source of cannabis can help get them back into balance and also treat that pain. So when you look at the receptors, they're all over brain, they're in your liver, your gut, your bone, your skeletal muscles, all components of your immune system, your heart, your connective tissue, they're just about everywhere. And that is why the cannabis compounds can be used to treat such a variety, such a widespread group of illnesses. So what is the role? And I've kind of told you already, you're sad over here, you've got this illness, infection, inflammation, a traumatic insult that turns on your endocannabinoid system to protect you, to repair damage, and to help you recover. But sometimes our illness, infection, inflammation, and traumatic insult is too much for us. It's overwhelming us, and we're kind of sliding down the slope that we really don't want to go down. And by taking an external source of those plant cannabinoids, we are augmenting or boosting our endocannabinoid system response. Many people talk about the endocannabinoid system tone, and the way, kind of a simple way to think about it is your muscle tone, right? So if you kind of are, your muscle tone is low, you may not be able to lift a heavy box, but if you have good muscle tone, you can lift the box. So just think about, you want your tone, your endocannabinoid tone to be good. You want it to be able to respond. And, a lot of people talk about, that this is kind of just a theory, but when you've seen thousands of patients, and I'm sure many of you are using cannabis yourself or your loved ones, or you've heard stories, there is no question that I have seen, and in my book, which is called Cannabis is Medicine, I have a story about a woman who came to me with like 10 years of chronic illness, just searching for the answer and spinning, and was creating a lot of anxiety and depression for her. I mean, she was really could not find the answer from doctor to doctor to doctor, medicine to medicine to medicine. And we started cannabis. And, you know, the first thing I recommended to her didn't do the trick. So we pivoted and try something else. And slowly, as she got better, and she'll tell you, cannabis saved her life, cannabis gave her life back. But it took her like 8 months to like where she said, I feel back to normal. I feel like myself. So, but remember, that's 10, like close to 10 years of severe chronic illness where she really couldn't find anything. And I'm convinced, of course, that her endocannabinoid system was out of whack and that she needed to, and it wasn't the only thing. She went, you know, changed her diet, started exercising more. So all of that feeds the endocannabinoid system and can lead to healing. And again, the whole idea here is homeostasis. So now I'm just going to show you real quick, and I kind of mentioned it before, but I think it's important to know the details because I know when I very first started working in the cannabis with patients with cannabis, I didn't quite understand exactly how does this endocannabinoid system work. So I'm just going to walk you through it, follow the numbers. So one, well, first, this is your neuron sending a message to this neuron. Number one is release of those neurotransmitters like serotonin, dopamine, norepinephrine, acetylcholine, and so on. They bind to a receptor, neurotransmitter receptor. And if that message is imbalanced, usually it's too much message, the message of anxiety, the message of severe nausea, the message of pain, your body goes into, we have to balance this message, right? Turns on the little factory that sits on the cell wall of that receiving neuron, takes your healthy fat and creates your EC, your endocannabinoids. They travel backwards. Now, I just want to talk about this retrograde signaling for a minute. There's not much else that does what we call retrograde signaling. When I was in medical school, so I went to school 1986 to 1990. This was just being discovered. I learned that neurotransmitters only go in one direction. That's it, one-way street. And it turns out that there is this retrograde signaling, and those are your endocannabinoids. They bind to the type 1 receptor, and you can see here number 5, inhibition of neurotransmitter release. Slows that down. And if you've ever seen anybody who has cancer, who's vomiting or very, very nauseous, literally a puff off a vaporizer, even a joint, just a little tiny puff, just will knock that out. It is not magic. What is happening is THC is coming along from outside the body, binding to these receptors and inhibiting that over nausea message. Okay, I hope that makes sense to everybody. Now, when we look again, I'm just going to drive home this idea here, involved in lots of things: reproduction, analgesia, motor coordination, sleep, and thermoregulation. Your actual temperature regulation is reliant on your endocannabinoid system. Highly involved in your stress, emotions, and anxiety. Appetite, metabolism, memory, glial formation. Those are the cells in your brain that help kind of keep your brain clean and make sure all the messaging is good. Synaptogenesis and neurogenesis. So neurogenesis is the birth of new neurons. So think about like building a house, and synaptogenesis is building the roads between those houses. Your endocannabinoid system and cannabinoids can influence neurogenesis and synaptogenesis. And so, and here they just have there's a very nice graphic with these various components of the endocannabinoid system. Now, what happens when your endocannabinoid system is sick itself, right? And so the idea here, and this was posited by Dr. Ethan Russo in the early aughts, like, I don't know, 2003 or 2004 or so, and this article is from 2008, but he talks about a clinical endocannabinoid deficiency. So what does that mean? Not only so for instance, I mentioned children with autism, if you measure their anandamide, it's lower than neurotypical children without autism. Not just is it a true deficiency of your endocannabinoids, but it can also refer to a deficiency of how the system runs. The fact that the receptors are not working well, that your enzymes may not be working well. And I'm going to show you some examples of that. But clinical endocannabinoid deficiency, from when Dr. Russo put that theory out. And again, if you read the subtitle, can this concept explain the therapeutic benefits of cannabis in migraine, fibromyalgia, and IBS? So it was this triad that he talked about and other treatment resistant conditions. This triad is very interesting because especially if you're a woman who is diagnosed with migraine, fibromyalgia, or IBS, you're kind of like, yeah, you got too much stress. It's all in your head. Well, yeah, it's your endocannabinoid system might not be working properly. And it's not a structural problem. You don't have a structure issue with your brain or a structure issue in your nerves. It's how they're functioning that is not being managed well or is off, out of balance. And so since this article was published or since this idea was put out into the world, all of these conditions listed here have been found to have some component of endocannabinoid deficiency. And one thing that I always say is if you go, let's say, to a neurologist who doesn't acknowledge the fact that your endocannabinoid system even exists, how do you find help for your migraine headaches? If you go to a GI doctor who wants to just kind of say, oh, you have IBS and here's a prescription for some medicine that does X, Y, and Z, are you addressing the root cause? Maybe your endocannabinoid system imbalance needs to be addressed. And I really believe that when I'm seeing people with chronic illness or people who are floating around with fibromyalgia diagnosis for years and irritable bowel syndrome for years, or anxiety, severe anxiety that can't seem to get under control, depression, Parkinson's, ADHD, all of these kind of conditions that often are very difficult to treat. Think about in terms of a cure, all of these conditions are very difficult to cure and very likely, and at least from the literature, have some evidence of an endocannabinoid deficiency. It is, and but I don't want everybody to think that just by correcting the endocannabinoid system that it's perfect. Sometimes targeted treatments are needed, but that should include addressing the endocannabinoid system issues. Now, I'm just going to talk about some genetic alterations. And so remember our genomes, our DNA, that makes up our DNA makes up our genome. And we've got these 4 nucleotides, and there's different letters for them. So A, T, G, and C, they stand for adenine, thymine, cytosine, and guanine. And they're linked in long chains. And then, believe it or not, you have 3 billion base pairs. So you can see G is paired with G, C is paired with C, and so on. So you have all these base pairs. And sometimes, well, for most of us, our nucleotides, these little letters, are identical, very identical between individuals. That's kind of what makes us humans and so on. But certain sequences can vary from person to person. That's what makes you unique, right? We all understand we have different fingerprints. Well, all of us have little variations in our genetic code. And so these variations are known as polymorphisms. That's the P in SNPs. And a SNP stands for a single nucleotide polymorphism, just a variation. So for instance, if the vast majority of people have a C in this particular spot, but you're a person that has a CT, you have a variation. If you have TT, you have more of a variation. So I just want to kind of explain that. But it turns out, how does that relate to the endocannabinoid system and to illness? So it's been discovered, for instance, that a gene polymorphism, so one of the little changes in the nucleotide, in the gene that codes for the type 2 cannabinoid receptor, that blueprint that tells your body to make those receptors, a little twist, literally one little replacement, may increase your risk of autoimmune disorder. A gene polymorphism that codes for type 1 cannabinoid receptor, they discovered one that may increase your risk of major depressive disorder. So a lot of people walk around and say, why am I depressed? I don't get why I'm depressed. You know, my life is pretty good. Remember, that blueprint is sending a message. And if it's part of this, the coding for a portion of your endocannabinoid system, you may be able to overcome that polymorphism by helping to augment, using cannabinoids to augment that system so that it functions a little bit better. I hope that makes sense. Now, this is really interesting. So there's an enzyme called FAAH. It's fatty acid amide hydrolase, but we call it FAAH, F-A-A-H. And depending on the difference in that SNP, that single nucleotide polymorphism, if you have one kind of alteration, you may have a decrease in anxiety and pain. I know there's some people in my life that have very high pain threshold. And I look at them and I think, how could this not be bothering them? Well, they may be genetically coded that way, right? But also you could have a SNP in your FAAH enzyme, the gene that codes for the FAAH enzyme, in the face of childhood trauma, which may increase your risk of PTSD. So remember, when people different from you, this is why we always should have grace and compassion for other people. Their genes may be different than ours and very likely are. And something that might not rattle you might rattle them. And that could be genetically coded. So just to throw that in there. But here's a very interesting story about a woman. This was published in the New Yorker magazine in January 2020. This was a Scottish woman who had gone through childbirth and some other harrowing experiences in life and never felt pain. She also never felt anxiety. She doesn't know what anxiety is. I wish I could trade places with her. But anyway, after she had some difficult surgery, I think it was like an arthritis, did something with her thumb. I'm sorry, it was like a arthritis surgery. I can't remember exactly. But she literally got one dose of pain medicine, I think, at the time of surgery. And during her follow-up, she just was like, yeah, I'm good, I'm fine. And the orthopedic surgeon was like, I have never met a person who doesn't feel pain from this procedure. It's a very painful procedure. And so he spoke about her to a geneticist he knew at the local university, and they decided to study her. And it turns out that she has a rare mutation on her FAAH gene, which I think I could show you the article here. So if you want to look in Google Scholar or PubMed, you can find this article. And basically what happens is that she does not really have the enzyme that breaks down her anandamide, her inner cannabis. So her inner cannabis compound is kind of always present, much, much, much higher levels they were able to measure. So it's almost as if she's like on an infusion of cannabis all day long, because she has this difficulty because her enzyme doesn't work to break down anandamide. So she just doesn't feel pain and anxiety. I encourage you to read the article. It's very interesting. I think it's available online. What's interesting too is they studied her son, and her son has a variation of this same mutation, although not as full bore as hers. And so he also has kind of a dampened down pain sensitivity, but he actually does feel pain. But much less than most people. So we are programmed by our genes to have a certain endocannabinoid system, but our lifestyle and our use of cannabinoids can help keep that into check. I hope that makes sense. Now, what about acquired endocannabinoid system deficiency? Well, that is a condition that comes from stress. So elevated cortisol. I was just talking about, I had kind of a crazy day today, and I almost feel like I could feel my cortisol coursing around. Elevated chronic stress elevates cortisol and decreases your endocannabinoid system tone, meaning it just can't work as well. You're kind of beating it down, and it can't respond in the same way. Here's a quote from an article. Endocannabinoid signaling, it appears to be a critical component of stress regulation, and impairments in the system may be involved in the vulnerability to stress-related psychiatric conditions, such as depression and post-traumatic stress disorder, which I've mentioned. And the whole idea here is that your endocannabinoid system and your stress response are very, very, very closely tied, critical components. And if you're feeling a lot of stress, I mean, I don't know anybody in today's world, especially in the United States, that doesn't feel a lot of stress. And it's good to feed your endocannabinoid system, maybe even if you didn't want to use phytocannabinoids, exercise, yoga, meditation, a very clean, healthy diet, connections with other people, believe it or not, massage and chiropractic intervention, osteopathy can help regulate your endocannabinoid system tone, all the things that we know that we should be doing, right? What about chronic pain? So when you have chronic pain, and when we say chronic pain, we're talking about over 3 months, right? So your broken ankle healed, but you now have nerve pain. You were in a car accident that left you with a crushed vertebra, and now you have chronic pain for a very long time. Diabetic neuropathy. I mean, we have a whole list of even migraine, headache, chronic pain for many years, right? Difficult to control. This affects the receptors and may change your endocannabinoid system signaling. So I mentioned to you in neuropathic pain models, they discovered that the type 1 and type 2 cannabinoid receptor expression decreases in those affected areas. It seems to be a maladaptive response. But phytocannabinoids can help restore balance. What you're doing again is you're just supporting that endocannabinoid system, augmenting and kind of feeding it. And if you want, I forgot to post in the presentation. There's a great article. It's a little bit old now, but it's a really nice article written by John McPartland, and it's called "The Care and Feeding of Your Endocannabinoid System." It's free online, and you should check it out. It's a really good article. What about poor diet? So as we talked about, diet's low in omega-3 fatty acids, which is needed to help build your endocannabinoids and keep your endocannabinoid system functioning. A typical American diet, for instance, results in reduced endocannabinoid system tone and also can impair your type 1 cannabinoid receptor response. And here's an article that talks all about that. So a deficiency in a nutritional omega-3 abolishes endocannabinoid mediated neuronal functions. So we definitely don't want that. Processed sugars, processed food and sugars can contribute to endocannabinoid system dysregulation, especially through the gut-brain signaling. And then sleep deprivation. Reduced sleep correlates with altered endocannabinoid levels and can promote hedonic eating, where you're up in the middle of the night, looking for the food that makes you happy, your comfort food. Chronic disruption due to sleep deprivation can definitely lead to endocannabinoid system imbalance. It says causality not fully established, but one of the main threads I see in my practice is that so many people who are chronically ill, of course, they have, this triad of pain, anxiety, and depression, and poor sleep. And I will share with you that cannabinoids can really make a difference because it doesn't just treat one, it treats all three. What about a sedentary lifestyle? So exercise increases anandamide. Everybody talks about the runner's high and that this is our endorphins. It is not. It is your endocannabinoids. There's no evidence in the literature at all that you have endorphins that are released during exercise. It appears that these are your endocannabinoids. And also, exercise upregulates your type 1 and type 2 cannabinoid receptors, and inactivity may lead to a lower baseline endocannabinoid system tone. Now, what about chronic inflammation? So this just refers to ongoing immune response. Your immune system is turned on and it's just pumping out all these compounds that we make, like what's called cytokines and tumor necrosis factor and all these various chemicals that our bodies make to create inflammation. And it's those triggers I just talked about. So stress, poor diet, chemicals, pollution, infections, autoimmunity, all create chronic inflammation. And chronic inflammation is linked to a number of difficulties and challenges, including joint pain, arthritis, brain fog, neuroinflammation, heart disease and stroke, increased risk of cancer, anxiety, depression. And you can see here swollen lymph nodes, poor digestion, insulin resistance, increased risk of diabetes, blood clotting issues, all kinds of issues that reflect chronic inflammation. Now, what about the endocannabinoid system and chronic inflammation? I've already mentioned to you that your endocannabinoid system, especially your type 2 cannabinoid receptors, will often help regulate chronic inflammation. So the endocannabinoid system, as it relates to inflammation, monitors and balances inflammation and sends that signal, calm down, turn it down. Remember the brakes, put the brakes on. And when you boost or enhance or augment your endocannabinoid system, It promotes healing and protects healthy tissue, especially in the brain and gut, to help decrease that inflammation. We know pretty much every phytocannabinoid that's been studied at some level are potent anti-inflammatories. So CBD, THC, CBG, CBDA, THCA, CBC, and CBDV all have been studied, and all of them have anti-inflammatory effects. What I often tell people is when you combine them, we know that you can see enhanced inflammation. I'm going to show you some studies. Also, remember, each one of these compounds is what we call promiscuous. It doesn't just hit one target. All of these compounds hit a multitude of targets that often give you, it's almost like, let's say you're just taking a whole plant or a full spectrum CBD. Yes, there's other compounds in there, but they're all going to target a bunch of different physiologic sites in your body to all send the message. All of them stacked together then help bring that inflammation down. And so we call that kind of stacked effects, or we call that the promiscuity of these compounds. And remember too that we talk about something called the entourage effect or synergy of these compounds. And I'm going to show you just some examples of that. So this is a very pretty graphic from a report put out from some researchers in Israel that study cannabis as anti-inflammatories, but also cannabis compounds for anti-cancer effects. And so what you can see here is all these different, and I don't worry about all the different letters and everything. Just the point here is what you see is you see CBD, you see CBG here, down here at the bottom, you see THC. And what's happening when you see a blunted arrow, so you see this flat instead of an arrow like this one here, that means it inhibits. And what are you seeing here? So a lot of inhibition on inflammatory processes through all of these various, like multicolored here. They made it pretty. So all these pink and orange are receptors, and all of these green compounds from the plant are binding to these receptors and sending a message, hey, dial down inflammation. Now, what's interesting here, you see a regular arrow. IL-10 happens to be an anti-inflammatory compound, and it's being enhanced. You're dialing up anti-inflammatory compounds that we make ourselves and dialing down the pro-inflammatory compounds. Now, I'm going to specifically show you CBD. So CBD has over 65 different targets in the brain and body. It makes it very difficult to know how any particular person is going to respond because it's hitting all kinds of spots. And for someone who says, well, I don't really like CBD, it actually may be targeting a balanced physiologic process and tipping it out of balance. That's why some people may not like CBD or some of these other compounds. So, and we call that kind of an off target. So it's not something we're trying to hit, but we do. And that's why I really believe that for some people who dislike certain cannabinoids or just say, that's not for me, I didn't like the way I felt on that, it's because it's hitting an off target. But what you can see here with CBD, so CBD lowers your FAAH, the enzyme that breaks down anandamide. So if you block that enzyme from breaking down anandamide, you get more anandamide, just like that woman who had that genetically programmed. But CBD can enhance your anandamide. That's one of the ways that it helps with epilepsy and autism and chronic pain and anxiety. Also, CBD decreases something called ROS through multiple, you can see a lot of different arrows here. It decreases, ROS is reactive oxygen species. So the way to think about reactive oxygen species is like a little spark, like inside your cell. So once your cell uses oxygen to make energy, how a car gives off exhaust. So the ROS is kind of like a little bit of that little spark of exhaust that comes off. And they are reactive oxygen species is actually okay. They can help send signals between cells. They can fight off microbials or germs. But when there's too many, they start to damage cells. So that's where CBD plays a role to help dampen down, again, that over messaging. Send a balanced message, dial those down. And that can lead to increased neuroprotection and less overexcited brain, so a more calm brain. I've already mentioned this through some other mechanisms. CBD decreases pro-inflammatory cytokines. the ones that turn on inflammation, and they increase your anti-inflammatory response. And then through some receptors as well, CBD as an antidepressant, anti-anxiety, and again, more anti-inflammatory mechanisms. So you can see that you have all of these different interactions with CBD. It's not just one place. And for many people, CBD, and in my experience, about 80% of people who try CBD do have a good response to it. But there's the small percentage of people that say that they don't like the way they feel on it. Now, what about THC? So THC binds, remember I talked about receptors, you can bind directly, you can have a partial, you can have on the site, you can block. So THC is a partial binder at the type 2 cannabinoid receptor. And when it binds on, it basically tells that cell, dial it down, turn down that immune overactivation, lowers levels of that pro-inflammatory, and again, is putting the brakes on acute and chronic inflammation. And so real world examples. So this, we all know people who walk, oh yeah, it feels great. I feel so much better when I use it. But in studies, documented studies, there's evidence that it reduces joint inflammation and arthritis, that it eases the gut inflammation in Crohn's and other gut inflammatory conditions called colitis, and also calms nerve inflammation in neuropathic pain. And this is, we're talking about THC right now. And I'm just going to show you a quick study. So this was a study done in Israel. They took 21 patients with Crohn's disease that were what they called intractable. What does that mean? When you see the word intractable, it means treatment resistant. We've tried everything, and these people, for whatever reason, don't respond. Okay. And what they did was they gave them inhaled THC versus inhaled placebo over a period of 8 weeks. So the patients did not know what they were getting. And what they saw was complete remission. And remember, these are intractable patients. Nothing works. 45% of them had complete remission versus only 10% of the placebo. 90% of the cannabis group had lower severity scores. So there's something called the Crohn's disease index, activity index. And basically, you answer questions. How bad is, and you have to answer the questions, and then there's a rating and you add it up. A high number means that your Crohn's is very active and not under control, and a lower number shows that your Crohn's is under control. So 90% of the cannabis group had lower severity scores versus 40%. This is after treatment. And that's all statistically significant. 3 cannabis patients were able to discontinue steroids, and all of the cannabis patients reported better sleep and appetite. So not just treating the condition, but getting other benefits as well. And then all the patients who went into remission, the minute they discontinued the study, within 2 weeks of discontinuing, they relapsed. And I'm just going to show you a graph here. So this is their score. So remember, higher score means more disease. So week 0, you see the placebo group in the light colored bar, and the treatment group who got inhaled THC in the dark bar. And as you can see over time, if you just look at the dark bar, it certainly goes down. By 8 weeks. Their number is almost more than half of what it was when their score is almost half, less than half of what it was when they first. And you can see placebo just kind of hung out here, right? And then week 10 is 2 weeks after that THC was discontinued. And you can see that it pops right back up almost as bad as it was basically when they very first started. And so this is, and I know it's only 21 patients, but this is really very important to see. Do these people with Crohn's very likely have some underlying endocannabinoid issue or deficiency, not just in their anandamide, but remember, just in the functioning of their endocannabinoid system that THC is managing for them, right? So that blueprint that's sending an abnormal message is being kind of overtaken and getting back into balance with THC. So that's the way that I look at this on a fairly simplistic level, to be able to understand, like, why did these people lie and say, right? But we don't think so, because we have a placebo group that did have a little bit improvement, but certainly not as significant as those who got actual medicine. So this is just one of many examples of of how these compounds can be very meaningful in terms of controlling inflammation that may be part of the genomic coding. What about CBG? So CBG stands for cannabigerol. There's been a lot more information about CBG, and we don't have a huge number of studies, but I definitely see an interest and an uptick in the research. So there's two studies here. This one looks at CBG for rheumatoid arthritis, but this is of course, in the laboratory and test tube, looking to see how does CBG lower inflammation, and it's through one of these kind of a receptor ion channel called TRPA1. And then here's another one that talks about the anti-inflammatory effects of CBG through these other signaling pathways. But it appears that CBG reduces the release of inflammatory compounds that's been documented in the skin, gut, and brain. And just interesting facts about CBG, it seems to be more potent compared to the same milligram amount of CBD for certain conditions. So I'll give you for instance, I had a patient that was taking 200 milligrams of CBD for a rheumatoid arthritis that was also had osteoarthritis on top of it. She wasn't a very old woman, but she was starting to have those changes in her hands from rheumatoid arthritis. And she was taking this large dose of CBD, and it was very expensive. And she said that she no longer could afford those high doses. And so we switched her over to CBG and started again with a low dose, titrated up. And she got to about, I want to say about 40 milligrams of CBG, where she reported equivalent results to CBD of 200 milligrams. The research that I've done on kids with autism also shows some similar results. One other thing about CBG is it targets a receptor that the other cannabinoids don't target. It promotes calming. It's the alpha-2 adrenergic receptor. It promotes calming and pain, inflammation, and fight or flight. And it looks like I have to speed up. I talk really a lot and too much here. CBD-CBG combo reduces neuroinflammation. This is not a human study, but what they found here was CBG alone was not as effective, and CBD was not effective, and CBD was only effective at the highest dose. But when they were combined, entourage effects, synergy, lowered pro-inflammatory compounds and increased anti-inflammatory compounds. And again, this is in the brain. CBDA is anti-inflammatory on a multitude of levels. This comes from an article in 2020. Not only does it affect receptors, but it also, CBD lowers your COX-2 enzyme. That's the enzyme that helps you produce prostaglandins, which are inflammatory, but also on the transcriptional level, meaning like affecting genes and also affecting these nuclear receptors. So CBDA is a very potent anti-inflammatory. Sasha, I hope it's okay if I keep going for a little bit. Yeah?
Yes, for sure. And
okay,
I'm
great.
gathering links up for you so that way we'll answer some of the questions. I'm sure.
Okay.
Yeah.
And I can stay a little bit. Yep. This is a article that looked at CBDA plus THC. They found CBDA produced dose-dependent pain relief and anti-inflammatory effects through a particular receptor or ion channel called TRPV1. But what I found very interesting here was that the subtherapeutic non-effective doses, meaning a low dose that you would not expect or did not actually do anything, subtherapeutic of CBDA, when combined with a subtherapeutic dose of THC, were actually quite effective for pain and inflammation. So you see, sometimes when you combine cannabinoids, you can get a better response than if you were to take just a higher dose of one. You can combine them. Okay, just a few more slides here. Other anti-inflammatory cannabinoids. So CBN is anti-inflammatory. CBN stands for cannabinol. It's like a cousin compound to THC. It has similar targets as THC, but it's about a quarter of the potency. But there are people using it for sleep, appetite, and inflammation. I don't have people getting high from CBN. So for a lot of people who either don't want the high of THC or don't like the high of THC, they often can find results with CBN. What about CBC? That's cannabichromene. It's understudied, very few studies, but they have shown that is an anti-inflammatory and lowers those pro-inflammatory compounds that we make and also inhibits the COX-2 enzyme. to block the production of prostaglandins, which promote inflammation. And there's an article there. And then CBGA, also quite understudied, but you're going to see a lot of research on these compounds over the next few years. But also has been shown to be an anti-inflammatory, was also found to reduce kidney inflammation in a mouse model. So that was kind of interesting too. And also blocked fibrosis of kidney disease. So quite interesting there. Now, important points. So every patient responds differently, even with the same condition. We are unique individuals in the way we respond to cannabis because our endocannabinoid system is genetically coded and our lifestyle alters it. So it is your own. What somebody else might say is great for them with the same condition may or may not be great for you. Of course, you want to start low and go slow. Anytime you're using cannabis medicine, you're trying to look for your dose. There is no one dose that fits all. So we say start low and go slow, but don't be afraid to go higher if there's no effects. If you don't feel it, your dose you need to escalate your dose. It's not that it's not working, it's probably you're just not taking enough. I remember when you take oral cannabinoids, what you get in your body, you could take 100 milligrams, but really what you're getting in your body is somewhere between 6 and 25 milligrams. We do not absorb it all unless you kind of take it with fat or take it in a nano or liposomal formulation. So there's ways to hack that. But in general, I don't worry too much in terms of the exact dose. Each person has to find their number or around their number, and that's what will work for them. And I'll tell you, I've got patients on 1 milligram of CBD, and I've got patients over 1,000 milligrams of CBD. So it truly is a unique response. Combination cannabinoids and synergy, I've mentioned that. You can get away with lower doses, also less side effects. Most side effects occur within the first few months, which makes sense. That's when you're experimenting. That's when you're trying to figure out, is this new compound I'm trying going to help me? How do you figure out if it's going to work? You do it by starting low, titrating up, and looking to see how your body responds to it. If you get an effect you don't like, you most likely have to back down. Medical patients, once they find their regimen, rarely experience unwanted side effects, because one of the goals that I find as a practitioner that's very important to me is that my patients don't experience unwanted side effects with cannabis. And then, of course, working with a knowledgeable practitioner increases your success rate and limits side effects. So I do encourage people, even if it's just one consultation or two consultations, just to dial it in to get an idea, especially for your unique situation. I'm just going to share 3 quick stories. So this is a 76-year-old female who has rheumatoid arthritis, treated with Plaquenil and Enbrel, very strong medication. She was very unhappy with the side effects, and she still had ongoing pain and inflammation. She smoked cannabis back in her 20s. She actually liked it, but got away from it with her career and her family life. But she started using a THC vape about 8 years prior. When I met with her, we added in CBD tincture about 5 years ago, and she had significant improvement. And she tried to discontinue her medications because she was feeling better. But once she went off those, she felt like the symptoms actually got worse. So she decided to just do combination cannabinoids with her medications. We decided to trial CBDA, but she didn't have any further improvements. But when we added CBG on top of the CBD and the occasional THC, she said that for her was the key. She saw significant improvement. She had no side effects. She was able to get off Enbrel completely. And now we're working to try to see if we can get her off the Plaquenil. So her regimen, THC vape is needed, and she usually takes at least once daily, usually before bedtime. CBD 50 milligrams twice a day, and CBG 25 milligrams twice a day. That's where we ended up. Here's a report. This is a 42-year-old with Crohn's. She was diagnosed in her 30s. She struggled with appetite, abdominal upset, just bad gut. She had a hard time keeping weight on, and a very frequent flare-ups to the point where she was actually confronted with potentially having a removal of her colon. She used cannabis a few times in college and just did not like how she felt. Probably overdid the THC because she felt paranoid and anxious, and usually that's a response to that recreational overuse. The joint gets passed, or the bong gets passed by too many times. She's been treated with steroids, methotrexate, and a drug called Remicade, and she was really unhappy. And she had described herself as someone who had every side effect of every drug. So she was really unhappy with the side effects. We started her on CBD 25-to-1 ratio twice a day, titrated up. And she was a great responder to the CBD. She was concerned about that little bit of THC in there, but I told her I explained to her when you have that high CBD, low THC is very unlikely to feel high as long as you start low and titrate up according to my directions. She felt 75% improved in 6 weeks, which I thought was a pretty good response. And then we added CBG in, and she reported feeling great, no side effects, my mood is better, and my gut is definitely improved. So her regimen was CBD 75 to 100 twice a day, and CBG 25 milligrams once or twice a day. Has a vaporizer for breakthrough, like if she's had a few episodes where she felt like the food she ate, or if she drank alcohol, it aggravated her gut. And so I encourage her to get a vape. She doesn't really use it very often, but she has it just in case. And then this is a 59-year-old male with osteoarthritis, overall healthy, very athletic guy. A knee injury about 5 years ago, had meniscus surgery. He was back to sports, but had pain and swelling of the same knee, couldn't climb stairs, wasn't sleeping well, reported 9 to 10 on a scale of 10 for pain when he was walking. He got steroid injections and also hyaluronic acid injections, that's like Synvisc. No improvement, and was recommended to have a full knee replacement. He started CBDA for pain and swelling. We titrated up to 100 milligrams twice a day. Pain reduced down to 1 to 2 out of 10. Went to physical therapy and then was able to return to light sports in 6 weeks. And then over time, felt like he didn't need as much high dosing and decreased to 50 to 75 milligrams per day after 2 months at that higher dosing. Also made it more affordable. And 2 years later is playing tennis, mountain biking, has not had surgery, and no change in his dosing, basically sticks with 50 to 75 milligrams per day. And there's his, and then, and he will take an extra 50 milligrams. So for instance, he says if he's like playing tennis, the next day he may notice a little more. So he'll take an extra 50 milligrams, either proactively or just right afterwards to help. All right. Thank you so much. Sorry to run over. That's my MO. I apologize.
No, this was great. So beautiful and full. And I know that there were some questions. I tried to chuck the webinar chat as full as I could with links, but I'm going to send those out to everybody who is on the call. I did have some requests from people to do so, so I'll make sure to do that. And this is being recorded, so we'll send it out to everybody and we'll get it on our website as well. But thank you so much, Bonni. This was so incredible and full, and I know a lot of people, I'm sure, got a lot out of this. And yes, we're getting some messages in too. 11 years in the cannabinoid industry. This is the clearest explanation I've heard. Excited for the Cannabis is Medicine book club on August 28th. So I put that in the chat as well. So thanks so much for joining us, everybody. Thank you, Bonni. And
let's do another.
Let's do another. We have to. Popular demand.
So maybe if, I don't know, but maybe if people want to send in ideas of something that they might want covered, I'd be more than happy to kind of start a series with you guys and just cover, whatever people are asking for.
Absolutely. Yes. If everybody wants to type in or write into our care team for suggestions, we will take those back to Bonni and plan for some future webinars. Absolutely.
All right. Sounds great. Thanks so much. Everybody have a great night. Bye-bye. Take care of your endocannabinoid system.
Yes.